Ovarian cancer. Ovarian cancer is a type of cancer that affects the ovary, which is the female reproductive egg. It is often said that it bites people what silently. You know, this ovarian cancer, it bites, in fact, it bites people what silently, because the signs and symptoms doesn't come until when the disease is what advanced. It doesn't come on time until when the disease has gotten advanced. That is when this ovarian cancer will do what? Show up. And you as an individual, you may not know. You may not know that you already have this ovarian cancer, because the signs and symptoms doesn't come as other kind of illness. So at this point, what are the risks, the factors that you might have this ovarian cancer? Number one is family history. If you are from a family where either your relatives or maybe someone around you have experienced this cancer before, your mother, your father, your relative, anyone around you has experienced this cancer before, my dear, there is all possibility that you might have it in time to come. Then number two is genetic. If anyone in your family has experienced this cancer before, there could be a possibility that this cancer is running in the gene, like it's running in your blood, the blood of your family, which means that there is a possibility that you also have this in time to come. And in medical terms, it is called the BRCA1 and also the BRCA2. Then the third one is age. You as a woman, you haven't given birth and you're already in your late 30s, my dear, you have a risk of having this ovarian cancer, but that doesn't mean that you're going to have it. Are you getting me? It doesn't mean that you're going to have it, but just have it in mind that there might be a risk of having it. Then number four is reproductive history. As a young girl, as a young woman, you have never given birth before, you have never been pregnant before, or maybe your family have this kind of infertility history, you have it in your family, there might be a possibility that you might have this ovarian cancer. Then number five is obesity. You know how obese people used to be now. Obese people, you know how they look like. If you're an obesity patient, there are chances that you might have this ovarian cancer. So if you have watched this video to this level, please do well as to what? Follow, subscribe, like, and share. Matanda Kubuomonagi. Please. So if you as an individual, maybe you have been asking, how can someone have this ovarian cancer? How can someone know that I have this ovarian cancer? Number one, always having abdominal pain or discomfort in your stomach. You always have this kind of discomfort in your stomach. You try taking pain relief, it's as if it's not working. The pain relief is no effect, is not showing as if it is working. Number two is bloating or swelling. You now see yourself as if your stomach is getting big when you didn't even eat anything. Number three is pelvic pain. Number four is difficulty in eating. You hardly eat, no appetite. Any little food you put in your mouth is as if your stomach is already getting big when you have not even eaten a good portion of meal. Just a little thing you eat, your stomach is already getting big. Number five is frequent urination. You're always frequenting the toilet, going to pee, coming back to pee. These are the signs and symptoms for one who has this ovarian cancer. But listen and listen good. That doesn't mean that if you go to pee regularly, you have this ovarian cancer. It doesn't mean that if you no longer have appetite, you now have this ovarian cancer. That is not what I said. It's not what I said. Just in case you're having this kind of signs and symptoms, do well as to see your doctor for a test to be carried out for you to know what the problem is. Are you getting me? Carry out a test first for you to know what the problem is all about. So why I'm saying this is because there are some illness that have also a similar signs and symptoms to this ovarian cancer, and not just believing that you have ovarian cancer all because of the signs and symptoms. So this is all I have to share with you guys in regards to this video. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and do well as to share with a friend if you got value. For all my returning subscribers and followers, this is Prince TV Global saying Thank you. See you guys in the next one. Bye.